Miliary TB. What is this form of tuberculosis? Imagine tiny seeds scattered throughout your body, each one representing a small cluster of bacteria. That's what miliary tuberculosis looks like under the microscope. It's a rare but serious form of tuberculosis, where the bacteria spread widely through the bloodstream, creating countless small lesions, usually between 1 and 5 millimeters in size. The name miliary comes from the resemblances to millet seeds, which are tiny grains. Unlike the more common form of tuberculosis that mainly affects the lungs in one area, miliary TB can involve many organs at once. These include the lungs, liver, bone marrow, lymph nodes, brain coverings, and even the heart. This widespread spread happens when the bacteria escape from the initial lung infection into the blood. From there, they travel to different parts of the body, setting up shop and causing tiny nodules to form. Symptoms can be tricky because they are often vague and not very specific. People might experience a prolonged fever that tends to get worse in the evening, chills, unexplained weight loss, fatigue, and weakness. Breathing may become difficult, and a persistent dry cough might sometimes produce small amounts of blood. When organs beyond the lungs are involved, symptoms related to their functions may appear. For example, if the bone marrow is affected, anemia can develop, or if the brain is involved, neurological symptoms may show up. There are two main types of miliary TB. The first is acute miliary tuberculosis, which tends to affect younger people under 40. It usually causes more noticeable symptoms like high fevers in the evening, night sweats, dry cough, and shortness of breath. The second is cryptic miliary tuberculosis, which is more common in older adults over 60. This form often presents with more subtle signs such as gradual weight loss and fatigue, and it may lack the classic fever, making it harder to diagnose early. People with weakened immune systems, young children under 4, and the elderly are at higher risk of developing miliary TB. Because it can spread rapidly and involve multiple organs, early diagnosis and treatment are critical. The bacteria reach the bloodstream either by eroding the walls of the tiny air sacs in the lungs or through lymphatic channels. Once in the blood, they multiply and trigger an immune response, leading to the formation of granulomas, small nodules that can be seen on imaging studies like X-rays or CT scans. Treatment involves the standard anti-tuberculosis medications, which are usually taken for at least 6 months. Because of the severity and systemic nature of miliary TB, medical supervision is essential to ensure the treatment is effective and to prevent complications. Early detection and proper therapy can greatly improve the chances of recovery. In summary, miliary tuberculosis is a form of tuberculosis characterized by the widespread distribution of tiny lesions throughout the body, caused by bacteria traveling through the bloodstream. It often presents with nonspecific symptoms that can be mistaken for other illnesses, making prompt diagnosis vital. If you suspect TB or experience symptoms like persistent fever, weight loss, or cough, it is important to consult a healthcare professional for appropriate testing and treatment.